We had to get that zero is possible thing concept from a nice bumper sticker to where it meets the daily work of each and every team member, contributing to the greater goal. Saying zero harm is one thing, but we had to boil that down to not just the caregivers, but each ancillary and support contributor as a foundation to our work. And so when you're in the midst of that harm event and you're focused on the caregiver, the caregiver is almost always an incredibly bright, highly educated, incredibly well-trained and licensed professional who has literally answered a calling on his or her own life to serve and help others. So how could a harm event have possibly happened, on their watch? Why didn't they execute all the elements of the pre-transport Foley bundle, or mobilize, or reposition, or why didn't they follow the steps in their process? The common theme that we've all heard in RCA after RCA is time. They were in a hurry. They had another task to get to. They had another patient to get to. And so as we began with the challenge that, Mr. O'Neill challenged us with 15 years ago, Mr. O'Halla challenged us with when he first arrived at Prisma Health, is let's address that time thing all the way down to the root cause. Let's remove as much of that consistent contributing factor to harm events as humanly possible. Let's push that concept to the theoretical limit, which led us directly to another thing that Mr. O'Neill ingrained in the leaders and was also aligned with Mr. O'Halla's vision for the Prisma way to pursue zero harm. And that was that organizations cannot be compartmentally excellent. They are either pursuing the theoretical limits in everything they do, or they're just not excellent. So we took that challenge from my new boss and from learnings with Mr. O'Neill. And at Baptist in Park Ridge, we took it and we set out to define excellence with pancake syrup. So let's think about the conundrum of time as it links into harm events and in all of the RCAs that many of us have thought through and worked through over the years. If a patient gets a breakfast tray and it has pancakes on it, but it doesn't have syrup, what does the patient do?
Right.
They push the call bell, right? And then a process failure in tray completeness has become a contributing factor to the caregiver's time issue that's in every single RCA that we've all went through. The nurse is now answering a call light, calling dietary, and delivering pancake syrup. If that nurse loses 10 minutes total because one tray was incomplete, then what other support and ancillary processes are impacting that time factor? What if they never had to look two or three different Pyxis machines before each med pass? What if every supply was where it was supposed to be, was never stocked out in a machine? What if they never waited on patient transport? What if the labs are always on the chart when the doctor's around and the nurse never has to call a physician for a decision that should have been made when the caregiver rounded? How much time could we give back to them? And then how close to the theoretical limits could they execute nursing processes in with the time we gave them back? And what impact could that have on qualitative outcomes? If we can simultaneously impact that time factor and have team members prove to themselves on the front line that zero process outliers is really possible in more rudimentary processes, the outcomes would be creating bandwidth for the hands-on patient care staff to do the same with more complex and patient-facing processes.